name is Erika Johnston McInerney. I'm a reproductive endocrinology and infertility specialist, and I see patients here on the Henrico Doctors Hospital campus for HCA. So in vitro fertilization can be a fabulous solution for patients that are struggling with infertility, but that said, it's not the solution for every patient. And so up to 50% of my patients will actually successfully conceive with LowTech solutions rather than using assisted reproductive technologies. Many of my patients share this concern that they may require advanced assisted reproductive technologies, and perhaps that concern may even keep them out of our office for an initial consultation. So I encourage everyone to voice that with their provider so that we can explore LowTech solutions first, and we really typically do so in a very stepwise fashion before launching into assisted reproductive technologies. Some of the LowTech options have been around for several years. For some of my patients, they don't ovulate regularly, meaning they don't release an egg regularly. And while we can help patients ovulate with more expensive infertility medications that are in an injectable form, the good news is many of them will actually respond to tablet medications that are less costly and less painful to actually administer. So oftentimes we start with either assisting a patient in ovulating with medication or encouraging her to make an extra egg or two each cycle so that she has a higher likelihood of conceiving with a singleton pregnancy. Another option that we offer to patients that are relatively low tech is trying to provide a higher concentration of sperm at the right time in the patient cycle. And so sperm have a lot of work to do. They have about 2 days of travel to ascend the reproductive tract, and one of the techniques that we use commonly is something called intrauterine insemination, or IUI, to provide a very highly concentrated grouping of sperm in the reproductive tract at the right time. It's not terribly painful, it's similar to a pap smear in the gynecologist's office. Patients can go back to work the same day. They don't have to be on bed rest or take a day off. The success rates for some of these lower tech treatments are really just modest, perhaps about 10 to 12%, depending on the reason that we're doing treatment in the first place. But that said, they're also considerably less costly, and so they're more available to many patients to engage in infertility care. So I encourage each patient to meet with me individually so that we can make a holistic treatment plan and look at the relative success rates and try and minimize costs to achieve their family. Some of my patients, they feel strongly about trying to have a conception outside of the laboratory, and this is of course understandable. So some of the lower tech treatments that involve additional egg with a tablet medication or even a low dose injectable medication rely on natural fertilization, and so it's nothing that's occurring inside the laboratory, and therefore for some people is more comfortable and resonates with them a little bit more strongly than techniques where conception occurs in the laboratory.